The situation unfolding inside hospitals is getting grimmer by the day, and the impact this is having on cancer patients is staggering. CityNews has obtained numbers that show how COVID-19 could be affecting potentially life-saving surgeries over the course of the pandemic.
Here we are no longer able to sustain our normal healthcare system. We're now at a breaking point.
We're learning more about the ripple effect this pandemic is having on cancer care. Nearly 6,000 fewer cancer surgeries were completed over the last 10 months. That's compared to the same time frame in 2019. Here's how it all breaks down. According to Ontario Health, from March of 2019 to January of 2020, just over 39,000 cancer surgeries were performed. But from when the pandemic was declared in March of 2020 to January of this year, that number dropped to just over 33,000, marking a 15% decrease in cancer surgeries. Dr. Shauna Hunt is a surgical oncologist at Sunnybrook Health Sciences Centre. He tells me all hospitals are at a tipping point and tough decisions are being made.
We are at a phase in this pandemic now where hospitals are once again ramping down scheduled activity. And I say scheduled because I'm loath to use the word elective.
And the latest COVID numbers paint the picture of a healthcare system in crisis. Right now, 1,427 people are in hospital with the virus, including 363 in the ICU. 242 are currently on ventilators. Dr. Ashamala says a shortage of beds and the redeployment of staff to COVID units are the main reasons some surgeries are being put on hold.
And this is where I think there needs to be a significant amount of fear. And people can say you're fear-mongering, but we're past that. This is a reality, and people need to know that we're at the point in this pandemic where the reality is that the healthcare system is not functioning as it should, and we are outside of a lot of evidence-based medicine. I don't know is going to come out of a lot of doctors' mouths when they're asked, can something bad happen if we wait?
This pandemic has also led to a lack of cancer screenings. In early spring, there was a major decline in testing for breast, ovarian, and colon cancers. And with many family doctors still only conducting virtual visits, there's fear people are going undiagnosed.
We hear from doctors that they're seeing patients come to them already now at where in the past they would hope to see people when they're at stage 1, stage 2. They're seeing people already with more advanced cancers at stage 3, stage 4. And then at that point, you have fewer options available to you.
As hospitals fill up and people wait longer to undergo potentially life-saving surgeries, the call to stay home and follow public health guidelines has never been louder.
Even if you're not afraid of COVID or you don't think it's a real threat to you or your family, if there's a car accident or someone breaks their leg and they don't have what they're used to in terms of a functioning healthcare structure, I think everyone should be able to relate to why that's so important.
No, Sunnybrook Health Sciences Center's communications department did not get back to me when I asked how many surgeries are being delayed. As for here at the University Health Network, it's not providing any numbers, but I was told through email that the overall system is seeing delays and will continue to see delays with care triaged based on medical need and urgency.